Welcome to Physician Heal Thyself, the podcast, empowering you to take a whole person approach to your well-being, spirit, soul, and body. Join me, your host, Dr. Lara, naturopathic doctor, entrepreneur, and a servant of Jesus Christ. We are not just a body, we are spirit and soul. It's time to integrate medicine and spirituality into our healing. Let's get started. Welcome back to Physician Heal Thyself, the podcast. I'm your host, Dr. Lara, and today we're going to continue on our conversation. Originally is how naturopathic doctors search for the root cause, identifying and removing the obstacles to cure. We've talked about the spiritual disharmony. We've talked about the diet, digestion, and then the stress component as identifying the root causes to those areas. Today, we're talking about the fourth obstacle to cure, which is toxemia. And so toxemia is traditionally a nature cure. It's a concept describing the accumulation of waste products and the toxic burdens that exceeds the body's capacity for elimination. And while this terminology, may differ from modern biomedical language, the principle remains important, and that is that the body is continuously processing metabolic waste, environmental chemicals, air pollutants, food additives, alcohol, tobacco, excess medications excessive medications, and then household toxins. So Nature Cure places an enormous emphasis on elimination. And so the body eliminates through our bowels, so through, the colon. The kidneys are a major organ of elimination. Our liver, huge organ that helps us with eliminating toxins. And of course, the lungs and the skin are also systems of elimination. These 5 systems are known as, we call them emunctories in naturopathic medicine. They're systems that eliminate waste. Now, we also know that women, because of, have a uterus, that uterus is also eliminating waste on a monthly basis. So it's very important that women are women who are during, obviously, menstruating still, that during menstruating years, that they're monthly menstruating because they are eliminating toxins in that way too. Now, understanding and working with the cranial system myself, the cranial system also has a way of eliminating toxins. And so it is through the cerebral spinal fluid that there's movement there. We know that as part of that elimination process, the lymphatic system is also key in this process of elimination. So when elimination pathways are impaired, your symptoms are going to develop. So when these organs or these systems are not properly eliminating waste, metabolic waste products, right, that we talked about, all of this waste is stuck in the person. And so it creates toxemia. It's toxins stuck in the body, and you're not going to feel good at all. And we're going to talk about what that can present. You can have a lot of, being sick more frequently than you like. You can feel very fatigued, brain fog. You can have skin rashes, conditions on the skin. And of course, many other medical conditions. All medical conditions have some toxemia correlated to them. And so the naturopathic questions that we would ask is, how can we support the body's natural detoxification process? And so this is why it's important that you are sleeping good at night, along with diet and exercise, right, and hydration, because all of those things contribute to the detoxification process. When we sleep, there's a little bit of a detoxification process, especially the brain is being detoxified, things are being metabolized, and so it's ready to be pushed out of the body when you wake up and you either urinate or you have a bowel movement through sweating, we release toxins through sweat, so through the skin, right? Exhalation, we're eliminating waste particles that way as well. So this does not mean that it needs to be an extreme detox, but we need to do there's different levels of detoxing. You could do like a minor little detox, mid-level detox, and then the very heavy, very extreme detoxification. And so it's, we have to make sure that we're supporting the normal physiology. So if we're doing some cleansing, I think I did a podcast on the difference between cleansing and detoxification in the past, because we could do a natural cleansing, and that's, safe without having to do blood work and tests. It's just supporting those organs, right? It could be even done just with diet, hydration, exercise, sweating, getting some sun, that will create a natural cleansing process. And so these, like I said, some things that we can do for the natural part is getting the adequate hydration with minerals and fiber-rich foods, because fiber will hold on to toxins to pull out. Making sure that you're having regular bowel movements. If you're not having a bowel movement every day, I've had people tell me every 3-4 days they'll have a bowel movement, or every week, sometimes 2 weeks. That's not okay. So that's the very first thing, is you want to regulate those bowel movements. You want to be able to, you're sweating through exercise. It's good. Get fresh air, get movement, making sure that your sleep is being restored, and reduce the input of toxins. I've done a lot of episodes on this before. Common toxins are the perfumes and deodorants that you're using. What are the chemicals in there? Makeup as well, getting a cleaner product. What are the things that you're using to clean around your house? What are the, are you using fabric softeners? Get rid of fabric softeners. They're very toxic. There's a lot of chemicals that are cancer causing and are hormone disruptors. And so you want to be mindful of what you're using to wash your clothes, to wash your body, to clean your house. So those toxins that you can eliminate, the foods, the toxins in your foods that you're exposed to. So those are things that you have control of. You're not going to be able to have control of everything in the world, but I say do the things that you do have control of, and don't freak out and stress out over every little thing, because that's the flip side that I see, is then people become so overwhelmed and stressed by every toxin in their environment. So do the best you can for now. Start somewhere and then work your way through that. But these are some practical things to do to clean up your environment and to help your body, right, to support your body to eliminate these toxins. Now, when we have certain questions that we will ask our patients when we suspect there's a much greater, right, toxic exposure. If we suspect heavy metals, if we suspect environmental chemicals or mold. And there's tests for all of those things that we can do to assess a person. But prior to that, there's usually some questions that will let us know, have they been exposed? First, we start with the mouth. Are there any dental amalgams that you have? Any root canals? Like, what's going on with your dental stuff? Like, what's going on in the mouth? Because dental health has a lot to do with the rest of our health. And so if there is some of those exposures there, then we want to go about it in a smart way. You don't want to just go and have a dentist take out all those dental amalgams that are usually mercury fillings. We want to find the doctors that are biological dentists that will go about the right and safe way to remove those. And there's a process of detoxing, preparing the person before. But the detoxing of metals, I want you to know, because I get this a lot. Can I do a juice with parsley, cilantro, lemon? And because I heard online that it will pull metals. Well, I hate to bust your bubble, but no, it's not going to pull a lot. It'll be more of a gentle detoxing for you. It's good. I've done them before. I like it, but it's not going to pull a huge amount of those heavy metals. For heavy metal detoxification, you need strong binders that are going to pull those metals out of the body. So oftentimes we'll do chelation or we'll do other forms of detoxification. There are a lot more that are more intense and profound, but we do have to prepare the person before these deeper detoxes. We need to make sure the bowel movements are well. We need to make sure the person is sweating well. And so we need to make sure that we prepare the body before we do a heavy, detoxification. And that includes blood work. That includes that your liver and kidney function is within a good, healthy range. Because if your kidney function's too low, if your liver function is, compromised, we can be creating an issue when we detoxify that person. So we want to make sure that that organ is going to be able to handle something like a heavy metal detox. Otherwise, those metals that are coming out, being eliminated through these organs, especially the kidney, very fragile organ, it can create more damage. And the damage that it causes, it can be a damage that's, that you won't be able to repair it. And so you're not going to be able to reverse that kind of damage. So we want to be careful because remember, it is a metal. And so it does cause damage in high amounts, especially when you're chelating, you're binding these metals and removing it through the organs. We want to make sure that it's safe, that even if a person does have healthy kidney and liver function, we want to make sure that we're safely and gently removing that at a right rate to see what is the patient able to tolerate. So these are things that I would not recommend you do on your own because the internet is crazy and I have seen people access these things on their own. I don't know how they're doing it. These things are all regulated. And so I know when I get the DMSA, DMSO, EDTAs, all of those chelators that are done either orally or through IV, they're prescription based. And so, and I have a due diligence. I have to do my due diligence of ensuring that this person is that we've properly tested for heavy metals. We're not just gonna chelate someone just because you think you have metals. We actually have to do tests, and those tests consist of unprovoked and provoked metal tests, and that means that you're gonna collect urine one day in the morning without taking anything. And you're going to collect that urine. And then another day, you're going to collect the urine, but you're going to take medication, a chelator in the morning to see what your body will release with that medication that will chelate, which is going to release more metals out in the bloodstream and into the urine. And so we want to see when we chelate how much more is pulling out. And so that will give us a 2 test it's called the pre and provoked test. To see how much metal is in your body without it being provoked and then after being provoked. And if you have metals in you without being provoked, then we know that you are being affected in a much greater way. And so that means your levels are greater. Of course, if we chelate that person, those levels are going to go up substantially. And sometimes it'll pull out even other metals that didn't show up in the first test. So we got to do those tests baseline along with the liver, kidney function and some other tests. And then we can know what's the appropriate chelator, so which is appropriate medication to chelate that person, because different metals require different chelating medications. And then the dosing that we want to start them off low. It's not something that you're doing every day for 30 days. There's a certain protocol of doing it sometimes 3 days on, and then a week off, or sometimes 5 days on. Everything is customized. So this is why you want to work with a doctor that is trained in this, who's getting continuing education on this. Naturopathic doctors, we learn about this, and many of us who do work with chelation, we do continuing education because that's the smart and wise thing to do. But either way, we always work where the patient's at, because even if the recommended is start at this dose, that person might be very sensitive. So we might start very low and gentle and getting them there. What I will tell you this is that in my process of helping people, through chelation, huge difference. So some of the symptoms that they'll have, they can have neurological issues, a lot of neurological issues, headaches or brain fog or loss of memory, concentration. They can have digestive issues. I've had people with a lot of joint pain, just a lot of joint pain. They feel like they're on fire. They say, my joints feel that they're on fire. And sometimes we suspect like rheumatoid arthritis or osteoarthritis, right? These inflammatory conditions of the joint. It can show up that way, but once we do the chelation, all of it is gone. And sometimes those rheumatoid factors don't even show up as positive, or we'll run a lupus panel, they won't show up positive. It's because it's the metals that are creating those symptoms. It's not that they have those conditions. And so once we chelate, all those issues go away. Obviously, there's a lot of other support that goes along with chelation. We have to make sure that their minerals are maintained, because chelators, they pull everything, and it's going to pull all of those minerals as well. They're considered metals, and so we want to make sure we're replenishing. So there is a process for something this in-depth of this kind of detoxification, right? It is a process of eliminating, removing the obstacle to cure, giving the body what it needs in the process of removing these minerals and supporting each system, right? Supporting the individual through that detoxification. And then we got to go and retest after we've done this a few cycles. And the way I do it is I evaluate the person, their symptoms, how they're doing, how they're feeling after each chelation. And if they feel good and we've done this for a couple rounds, then I say, let's go back and do the test again. It depends if we're doing oral chelators or IV chelators. With IV chelators, we do more frequent tests because the results are faster through IV therapeutics, but sometimes because of time and cost, the oral form might be more, it might be easier for patients to do for compliance and financial reasons. And they're both effective. I've seen them both be effective. But yeah, so we want to follow this process, and it's all catered to the individual. And the same goes for environmental chemicals. If the report comes back, and it'll show us where the high risk markers are, and so then we'll educate the patient on, these are the things you're going to have to start looking in your environment to eliminate, because you want to get them out of the environment so you're not getting re-exposed. And then this is the treatment that we'll do, and then we'll retest. I like to give people several months, 3 to 6 months before we retest. And the same thing with mold exposures. Identify what's coming up and then treat it, right? And with mold, if they are having mold in their home or work environment, sometimes I've had people that work in a place that has mold. There's some major decisions there. Either you're going to have to let the company know if they're not willing to change it, then you might have to make a change in your job. If it's in your home, then you need to get the proper testing and then the remediation of the mold in the home so that you're not getting re-exposure. Because if we detoxify you from mold, but you keep getting exposed to it, then it's not going to go away. And so the remediation at the home or the environment needs to happen as well. And sometimes, unfortunately, I do find that people have all three. There's metals, there's environmental toxins, and then there's mold. And so then we have to, I feel like once we start detoxifying one way or another, they're going to get rid of a lot of this stuff. But either way, they start to feel a lot better, like life-changing better. And guess what? I've noticed that when those toxins, all of those toxins are out of the system, their hormones, their blood sugars, the insulin, thyroid, all of those things start to regulate, right? Because if there is high levels of toxemia in the person, that's a huge obstacle to cure. And we have to remove that. And this is why we cannot chelate someone while they have mercury fillings in their mouth, because it will pull from the teeth and then you'll have more circulation. And it's very close to, it's in your mouth, it's in your head. So those metals will start to get into the bloodstream and affect the brain more. And people could have lead, mercury, many other metals exposures, and they can oftentimes present in a lot of neurological symptoms. And so, yeah, those are the tests, the potential ways to approach treatment. There's a really good comprehensive test that I do through this company. It's like a $550 test, and people sometimes freak out, and sometimes people think, oh, that's nothing. And I think it does all of it, all the heavy metals, all the environmental toxins you can ever imagine, plastics and pesticides, and the list goes on, and then all the mold as well. And it's a pretty lengthy report that comes back, and I review it with my patients and explain to them what's in. There's 3 different categories. The green it's not present, yellow it's moderately present, and then the red is like it's high. And those are the things that we tend to treat. And oftentimes when we treat those that are in red, all the others get corrected as well. But it's a total toxic burden test that is done, and it helps us to determine what are the toxins that are there. And so we only do it after we assess. We do a questionnaire. We ask several questions, and then I make the recommendation. Now, anybody can take it. It's not like you only have to have symptoms to take it. Anyone can take it. But when I recommend it, it's going to be because I really feel that I suspect toxins are there. And let me tell you, it's life-changing. I had a patient, had a skin issue, been to many doctors, and no one was really helping her. And so I asked her, have you ever been tested for environmental exposures? Because based on where you've told me you've grown up and lived and so forth, and then your symptoms, I feel like there's a really good case for, being suspicious of toxins. And she's like, no one ever asked about it. We did the test, and it revealed what was there, right? Metals, environmental chemicals. We put her on a detox program. Every month, it was every month was a different step of the detox in-depth program. And every month she was getting better and better. Her skin was improving. The lesions were gone. She felt better overall. Mental clarity, more energy, just felt really good. And so there you go. So you can make the investment up front, especially if we suspect those burdens are there. Make the investment up front. Find out if it's there. Treat it. And then it's gone, and then you're good. Or you can keep going from doctor to doctor, right? Spending time, money, your life, your quality of life on the line, and not get a solution, and many years down the road, then decide, okay, let me do this. So this is where working with the doctor is going to help you, because especially the right doctor, right? Your primary care doctor is not going to know any of this, unfortunately. They're just not trained for this. That's the reality. If conventional doctors were trained on this, then they would know to look for it. And this is where we are just trained different. We're in a different paradigm. We're looking for the root causes, the obstacles to cure, right? What could be contributing to this person's disease? Is it the spiritual disharmony? Is it the diet and digestion? Is it stress? Is it toxemia? Is it all of them? Absolutely. It could be all those things and more, right? And so sometimes that is the case. People have a little bit going on in all those categories, and we just got to fix it, clean it up, guide the person, have them go create a program for them that they can go and implement. They go implement the thing, and then their body, because you remove the obstacles and gave the body what it needed, whether it's to remove the toxins, give the proper nutrition, manage the stress, fix the gut, fix the spiritual disharmony, and it just all kind of works together, right? It works together. But toxins are a real thing, and you could be very spiritually connected and balanced there, and no trauma, none of this, but you maybe have had a lot of toxic exposures. So then we have to fix this. We have to help the body, right? Guide the body to remove those toxins and give the body what it needs to eliminate them. Our bodies are always detoxifying. And so if the toxic burden exceeds the elimination capacity of the physical body, then it's going to build up these toxins. And that's why, going to the bathroom frequent is important, because it's eliminating toxins. And these are the things that contribute to cancer. These are the things that contribute to autoimmune disease and metabolic issues and disharmony, neurological conditions, and the list goes on, right? Lupus conditions do this. And I'll tell you, because I've seen this enough in my practice, that women who have breast implants or any surgical, anything that's enhancing your body, that's a foreign object in your body, it is still a foreign object. And your body's so intelligent that it knows there's a foreign object here, and your immune system starts to respond. Your nervous system, immune system start to respond. And if these things like breast implants have, a lot of toxins, and it has the ability to build mold in them. And so this is what women can be also suffering with, is if they have neurological symptoms, pain, even seizures are experiencing. Sometimes they have lupus-like symptoms, and they may be tested and lupus comes up, but it's because of the implants, or it's because of whatever is foreign in their body. And this is why I'm very cautious. I'm very concerned with anything that we put in our bodies that are foreign to it, that are not naturally supporting our systems, like lip fillers and Botox and anything surgical that's going into our body. Like, what are these things? What are the consequences of those to our nervous system, to our immune system, to our overall health, because they're not meant there. I'll even say I'm not a fan of the GLP-1 approaches to weight loss. I'm just not, even in low dose, I'm not a fan of them, because I have seen what it's done to many people. And is it adding to health, or is it masking to make it look like you're reaching a healthy result, but really it's creating other symptoms? Something that's healthy for you is not going to give you side effects, is not going to give you a new medical condition. Understand that. Something that's really, truly healthy and designed for our bodies to be supported by these substances. Like, I could take ashwagandha, I could eat, berries and broccoli and cauliflower, and they're providing nourishment to my body. They're supporting my body. But the moment I put something that our bodies are not originally designed to take in, it is going to create side effects, is going to create other medical conditions. So that's my take on that. And I am going to shame my community for this. I truly believe, as naturopathic doctors, we should not be prescribing these things. Absolutely not. We want people to make real change. Then let's have the real conversation. Why is it? What's the obstacle, right, in your mind to making that dietary change, to implementing that? Is it stress? Do you feel depressed? Do you not have the energy to do it? Let's support those systems. Let's do this tango dance with their health until they get the moves down. Because if not, we're lying to them. We're making them think that this thing is going to be the magical miracle solution, and it's not. Healing is really this simple. And so, I like to support my patients by spiritually encouraging them, by encouraging them to eat better, by giving them the tools, helping them provide tools, whether it's things that they're supporting with herbs or homeopathy, or techniques that they're using to support their stress, their nervous system, right? The stress response, encouraging them to sleep more. The basics, keep it to the basics. The foundations of health are this. They're that simple. And, a great teacher, mentor in the naturopathic community recently said at a conference, he said, naturopathic medicine we can practice anywhere. You can drop me anywhere in the world. I don't need a license. I can just be left anywhere in any part of the world, and we can do this kind of medicine because we're using the laws of nature. We're using nature concepts to heal. And so that doesn't require a license. It doesn't require a license for me to tell you, go to bed earlier, sleep 7-8 hours, make sure you're resting. Make sure you're not eating foods that are causing inflammation. Eat more vegetables. It doesn't require a medical license for that. It doesn't require a medical license for me to say, pray and meditate so it can help you with your nervous system and your stress. Go exercise. Let's go for a walk. That doesn't require a medical license. It is common knowledge at this point, but there are obstacles for us to get there. And I truly believe it's the overwhelm of stress that we have. So work on your nervous system, let go of what doesn't serve you. Just like when you go have a bowel movement, you let that waste go. Let the things that are toxic in your life that don't serve you, eliminate those things, right? And then give your nervous system, give your soul, your spirit, the things that you do need that bring life into you. Eat the foods that give life, give the spirit the things that give you life, find the things that, give your body life. And with that, we've covered those obstacles, right? Finding the obstacles to cure, finding that root cause and treating those there. What does it look like when we implement that? And so I hope you've enjoyed this conversation. We're going to continue more educating on things that you can do. All of these things that we've talked about, you can start implementing, except the heavy metal toxins, detoxification, those you want to be very careful, right, in getting someone that can help you, guide you through that. So I want to thank you for joining me on this episode, and until next time, be blessed. Thank you for listening to Physician Heal Thyself, the podcast. If you like what you've heard, please like, share, and subscribe. Help this message reach more people who may need to hear it. Leave your comments. I want to know what you think. If you're interested in learning more about Raices, visit our website at raicesndmedcenter.com. Until next time, be blessed.